So today we're going to be covering what baby's stool looks like. And not to ruin anything, but it can look really, really different and still be completely normal. We're also going to go over what we can actually learn from baby's poop. I'm Dr. Tala and I've been a neonatologist for 16 years now. And let me tell you, I'm actually pretty obsessed with baby's poop, which sounds like a super bizarre statement to make out of context. But anyway, anybody that's ever worked with me will tell you that several times I've dug through trash cans looking for diapers that have been thrown away so that I can properly examine the stool. So yes, you can learn so much from baby's stool. It really is a window into the baby's gut health. As an example, a few years ago, I was rounding in the cardiac unit on the neonatal babies, and there was one baby that I was about to go in and examine who'd had surgery about 2 weeks prior to that, had had heart surgery, and was having a really hard time gaining weight and tolerating feeds. I was just about to go in when the nurse walked over to me and holds up this full diaper. "Smell this," she said. So just as an aside, I think I have a really poor sense of smell, but in this case, the smell was absolutely overwhelming. It was extremely foul smelling. "It's salmonella," she said super confidently. And in my head, I was thinking, what are the chances of this baby that hasn't actually gone home yet actually having salmonella? But based on her clinical judgment, we ended up sending a stool culture, which is not something that we normally do. And I'll talk about that in a bit, why we don't do it. But lo and behold, it came back as salmonella. And we treated the baby with ampicillin, and the feeds, the weight gain, as well as the baby's irritability really improved. So yes, stool, its color, its consistency, its appearance, its smell, all of these can really give us clues about what's going on with the baby's gut. So for this video today, we're going to cover basically two things. First of all, we're going to start by what normal stool looks like and all the different variations of normal stool and what kind of causes it to be slightly different. And then two, we're going to cover what abnormal stool may look like. Okay, let's start with one, what normal stool looks like. And logically, let's start with the first stool that babies pass. As you all know, that stool is called meconium. Meconium is that black, tarry, really sticky stool that babies pass after birth and for the first couple of days of their lives. The meconium is made up of intestinal cells, intestinal secretions, mucus, proteins, bile, amniotic fluid, really everything that's been gathering up in the intestines before the baby was born. Because, as you know, babies don't stool when they're in utero. They don't pass meconium when they're still inside their mummies, unless their bodies are extremely stressed, which is another way of saying that their bodies have lacked oxygen. If that happens, then yes, they can end up passing meconium in utero. If they're super stressed and they pass meconium and they're gasping, then they can end up aspirating that meconium. And just because you see now how unbelievably sticky it is, you can see how much damage that meconium can do to a baby's lungs. As an aside, these are awful diapers to change. They're so sticky, it takes ages. Every time I go to examine a newborn baby and it's got a huge meconium, I'm like, oh, there goes 5 minutes, because you have to be able to kind of examine everything really well around it, so you have to change it. A term baby should pass meconium within the first 24 hours of life. If I get called at 24 hours or just after that and I'm told that the baby hasn't had a meconium stool yet, then the first thing I check is did the baby pass meconium in utero? Was there meconium stained amniotic fluid, or was the baby passing meconium as he was being delivered? Obviously that counts as passing meconium in the first 24 hours of life. The second thing is does the baby have a normal physical exam? Is there a patent anus? Is there abdominal distension that could suggest that maybe there's some sort of obstruction or something? Is the baby vomiting? Obviously also more concerning for some sort of obstruction, especially if that's bilious vomiting. Is the baby eating enough? So is he taking and tolerating his milk or formula, and has the baby peed? Maybe the baby just isn't kind of getting enough for the intestine to be stimulated. If the baby appears to be eating well and has urinated and the physical exam is normal, then usually we'll just give it a little bit longer. Most of the time they end up pooping. And we can talk more about lack of stool or constipation in another video. For now, let's get back to the meconium. So babies can end up passing meconium for about 2 up to about 5 days of life. After that, the poop they pass is called transitional stool. Transitional stool normally looks like it's meconium kind of mixed in with regular poop. So it ends up being this kind of dark greenish color a lot of the times. It can be a lot stickier than normal poop as well, kind of more like the meconium as well. Then the stool from kind of day 5, day 6 onwards will really depend on what the baby's actually eating. So breastfed babies generally will have a yellow mustardy type stool that's kind of soft and yellow in appearance. Whereas if the baby is being formula fed, formula has a higher iron content in it. And a lot of that iron doesn't actually get absorbed into the gut. So a lot of that iron ends up in the poop, which makes the poop a lot darker. So formula fed babies will generally have like a darker greenish type of poop. Or if you're in the unit or outside the unit and breastfed babies are being given iron supplementation, then again, not all of that is absorbed, and that's probably going to make the poop a little bit darker as well. Again though, after that initial meconium, a baby's poop can be loads of different colors, depending on if the baby is breastfed, what the mother has been eating, or depending on the type of formula that the baby is getting. I usually tell parents that baby stool can be really any color, from yellow, orange, green, or brown, as well as loads of different consistencies. And as long as the baby's pooping and gaining weight, then it's probably completely normal. In the NICU, a common cause of orange tinted poop is when we give the ADEC vitamins. So if a baby has liver failure or cholestasis, also the ADEC vitamins have kind of a higher zinc content. So sometimes we've been given the ADEC vitamins to kind of help with growth as well. But generally when we supplement extra with these ADEC vitamins, then it can give like this kind of orange tinted poop. It can look a little bit odd, and we're often explaining this to parents. Another weird cause of orange poop, and actually lots of orange secretions, is the antibiotic rifampin. We don't often give that in the unit. Sometimes we double cover with Vanc if there's like a really bad staph infection. But again, be aware of the fact that antibiotics or the medications that babies are on can change the color as well as obviously the consistency of the poop. When babies are older and they've started eating solid foods, so generally out of the NICU, then just eating orange foods like carrots or apricots can also make that poop more orangey. But realize this, we're not the only ones who are obsessed with babies' poop. Parents are really obsessed with babies' poop as well. So just reassure them that babies can have lots of different types of poop, and it can change for a few days and then kind of go back to its original color a few days later. But when we're in the NICU and we are on one type of formula or breast milk with fortification, the stool really shouldn't change that much, unless obviously we're changing the formula or we're changing the fortification or we're changing the calories or we've added another medication or something. But if the stool has greatly changed and everything else has been consistent, then that could be indicative that something is going on with the gut. 2. Now let's get onto when the stool is abnormal and all the different types of ways it could be abnormal. The first thing I really want to stress here, and this is like if you get one thing out of this video, then this is what you should be taking out of this. That the color of the stool that we worry about the most is when the poop is really pale white or this kind of clay colored stool. If the stool is lacking any bilirubin pigment, then it will appear really white or clay colored. So remember that it's the liver that dumps the bilirubin into the intestinal tract. So if you have a blockage in the liver or just after the liver, before that duct that kind of delivers the bile into the GI tract, then obviously you're not going to end up with any bilirubin in the stool. So really any obstruction in those ducts or some sort of obstruction in the liver can end up with this clay colored stool. One of the things that we're very worried about is a disease called biliary atresia. Biliary atresia is a very bad but quiet disease. Often this doesn't present for weeks, but the earlier that the disease is caught, the sooner that surgery can be done to try to kind of fix the drainage of the bile ducts, and the better the babies do. Stool cards are published in many countries and given to parents so that they can identify what normal and abnormal poop looks like, and just really to kind of reinforce the fact that white or clayish colored stool is dangerous. And if anybody sees this white or clay colored stool when they're at home, then they should definitely tell their doctors. If you don't have a stool card, then just be sure when you're discharging patients to tell the parents that white stools are concerning and to alert their doctors if they see it. Conversely, if I'm in the unit and I see that the direct bilirubin is going up on the baby's labs, then the first thing I'll go and check is the baby's poop. If the baby's poop is nice and green, then it's very unlikely that we have an elevated direct bilirubin because of an obstructive issue. So it's unlikely to be biliary atresia if the baby's poop is nice and green. So it's more likely to be like a TPN cholestasis or a viral infection or something if the poop is green with a rising direct bilirubin. Still though, you should be certain and get an ultrasound of the liver and everything else and make sure that you're not missing anything anatomical. What other things cause us to be worried about poop? As you all know, one of the things that we're pretty obsessed about in the NICU and at home is whether there is any blood in the poop as well. There are lots of pretty benign reasons for why there could be blood in the poop, but it is always abnormal and it's always something that we should take seriously. Also realize that the blood could be just like a tiny smear on top of the stool, or it could be like throughout all the stool and kind of completely engulfing in it. Obviously, we'd be a lot more concerned about the second scenario. Realize though that the blood can come from other places in that area and not just from the rectum. So in girls, they can have like a pseudomenses, where they can have some bleeding from the vaginal canal a few days after birth. Sometimes there could be blood in the urine, or if the baby's pretty dehydrated, then sometimes the urine can have these kind of reddish clay crystals in it. That's an alliteration. So they kind of look like these reddish dark crystals, which can end up looking a little bit like blood if it's kind of mixed in with the stool and stuff. A baby could also have a really bad diaper rash with excoriation of the skin. So painful. But that could also end up with some bleeding, and it looks like it could be coming from the poop. What about reasons from the gastrointestinal system where you end up seeing blood in the poop? So one of the first things that you look for, especially if there's only a tiny bit of blood, not kind of gobs of blood in the poop, but you look around the anus looking for an anal fissure. That's actually a pretty common cause of blood in the stool in the NICU. The baby could have a cow's milk protein allergy. Normally, blood in the poop will be mixed in with other symptoms as well, like irritability and poor weight gain and everything. Or the baby could have swallowed some blood, whether it was at the time of birth, or for example, if the mother has really cracked nipples and baby's actually kind of swallowing some of that blood as the baby's breastfeeding. How amazing are mothers, by the way, that they're literally breastfeeding through that type of pain. Also, sometimes we see small specks of blood from irritation from like any instrumentation that the baby had. So for example, if there was a gavage tube in the stomach that was kind of irritating the gastric mucosa, or maybe the baby had a traumatic intubation and kind of bled a bit and end up swallowing a little bit of that blood, then sometimes if that blood goes rapidly enough through the gastrointestinal system, we'll see kind of bright reddish blood in the poop. Then the cause of bloody stool that we all worry about the most, as you all know, is NEC, or necrotizing enterocolitis. So realize that usually if a baby has a bloody poop and it is NEC, then the baby's probably going to have other symptoms too, whether it's abdominal distension, not tolerating their feeds, lethargy, increased apneas, something else that could indicate how sick that baby is. Also in NEC, just because the gut is so sick, the rest of the stool will also appear abnormal. It won't be like the same stool that the baby's always having with a little bit of blood in it. The whole stool will look watery or smell worse or just look different from the baby's previous poops. We're all so worried about neck in the unit that if there's really any chance that the bloody poop is neck, then we'll usually just get an x-ray looking for pneumatosis and everything else just to be certain that we're not missing a case of necrotizing enterocolitis. So what about if the stool suddenly becomes really watery? Again, that kind of depends. If the baby is on antibiotics, then that can make the poop really watery. Or if we increase the calories, then sometimes it takes a little bit of time for babies to get used to the extra calories, and initially the stool can become a little bit more watery, even though normally when we go up in calories, eventually the stool actually becomes a lot more solid. Babies who are withdrawing from narcotics, whether the mother was on heroin or methadone or something, or whether it's an iatrogenic withdrawal, so the baby was on fentanyl for a long time and we're slowly trying to wean the baby off, then basically if the baby's body is withdrawing, they can end up having really watery stools. And watery stools could be an indication that we're not adequately treating the baby for their withdrawal symptoms. Babies could also have an infection directly in the gut that's actually causing the watery stools. So it could be a viral infection like a rotavirus or an enterovirus, which obviously we're always trying to really avoid in the NICU, or it could be like a bacterial infection, like the salmonella that we talked about at the beginning. Like I said at the start though, we hardly ever actually culture the stool. And the reason for that is that there are literally trillions of bacteria in the gut. And we know that if we culture it, most likely we're going to end up growing something out. So it doesn't really help us a lot. It doesn't necessarily say this is the cause of the infection or of whatever is going on. What we would do is send a blood and urine culture and maybe some viral PCRs, hoping that we can actually catch the bug that way. Remember as well, baby's immune system is so low that if they have something in the gut, there's a very good chance that it's gone all over their body, in their blood and everything as well. But generally, and I would say this is true most of the time, we don't really worry too much about the occasional watery stool, especially if the baby seems like the baby's not irritable or the baby's doing fine with it and the baby is gaining weight. A lot of the times they'll just have one random watery stool and then the next stool will be solid again. But if the baby has really watery stool and the baby is not gaining weight, or the baby's acting really colicky, so kind of like their belly really hurts and they're irritable and it's all just a little bit distended, or they have like a really bad diaper rash, then these could all be an indication that the baby is not tolerating its formula or its milk. If the baby doesn't have enough enzymes or doesn't have the enzymes at all to digest certain proteins or carbohydrates, then basically those macronutrients will pass through the GI tract undigested and they'll pull water with them, making the stool a lot more watery. Babies aren't absorbing the macronutrients they need, so they won't be gaining weight as well. And then all those nutrients in the stool will really irritate the diaper area, so the buttocks, so it can really cause a very bad diaper rash. So if you do see all these signs, then there's a good chance the baby is not tolerating its formula, and we may have to change that formula, or the fortification of the milk or whatever else. In a similar vein, sometimes the stool can be really foamy in appearance, and this could indicate an abnormality in fat or carbohydrate absorption, so digestion and absorption. Generally, when a mother is breastfeeding, the foremilk, so the milk that's immediately expressed that the baby gets, is higher in carbohydrates, and the hind milk is higher in fat. That's why when babies aren't gaining weight well, we sometimes put them on a more exclusive hind milk diet to get them to have more fat. But sometimes babies guzzle down so much foremilk that they end up taking in a lot of carbohydrates and their bodies aren't able to actually digest and absorb all that carbohydrates. And so they go through the intestinal tract and you can end up with really foamy stool because of that. If this seems to be the case, then what we do here is we make sure that the baby only feeds on one breast at a time to try to make sure that the baby is getting some of that hind milk instead of getting full milk from both breasts. Or we get the mother to pump a little before the baby starts feeding so that the baby gets to the hind milk sooner. Foamy stool can also indicate some sort of fat indigestion. So this could be just a transient issue as the baby's enzymes are slowly still developing, or it could be indicative of something more serious like cystic fibrosis. Again, like with everything we've said so far, with foamy stools, look at the big picture. Is the baby gaining weight okay? Is the baby otherwise doing great? If that's the case, then we can most likely ignore the foamy stool. Okay, what about abnormal smell? And we've all had those babies in the unit that, for whatever reason, their poop is just a lot stinkier than the other babies. A lot of the time, this is because those babies are on higher calories, so 26, 28, even 30 calorie per ounce formula. And basically what ends up happening is not all of those extra calories are digested and absorbed, so the bacteria in the gut has kind of more to work with. And it's normally the bacteria in the gut that are responsible for producing those like stinky gases. Generally, when we go up in calories as well, the stool can become a lot more solid. So sometimes those babies also do start to have issues with constipation. And again, we'll talk about that in another video. If the really stinky poop come with other symptoms, for example, poor weight gain or abdominal distension, then we could be worried about something else like an infection, like we talked about the salmonella at the beginning. In babies with short gut syndrome or with an ostomy, then if the stool starts smelling a lot worse, then sometimes I worry about bacterial overgrowth. So sometimes these babies end up needing a course of Flagyl or something to just kind of temper down all the extra bacteria that's been growing in their guts. Again, put it into context. Have you changed something recently in the baby's diet? Or is this like a brand new unexpected symptom and there are loads of other concerning symptoms going on as well? Obviously, in the latter case, you're going to take it a lot more seriously. Okay, that was a lot about stool. I hope that you all learned something. If you want the PDF summary of this video, then go ahead and join our Neonatal Nuggets newsletter. In the meantime, please like this video if you liked it and comment and let us know where you're watching from. Thanks so much for being here.